Everyone. Thank you so much for joining us today. On behalf of our RISE office, welcome to Berkeley Public Health. We are so excited to be kicking off activities for this year's Spring Visit Day with all of you today here on Zoom, but we hope we'll also get a chance to meet some of you in person next Monday if you will be joining us on campus. Uh, Thanks also for introducing yourself in the chat. Please feel free to consider sharing if you'd like your name, pronouns, program, and if there's something that's brought you joy today. We want to be uplifting one another in this space today and in general. That's our orientation here in the RISE office. So I'll add something that's bringing me joy is I keep thinking that the cherry blossoms have peaked and then I see more. So just all of those popcorn trees right now are bringing me a lot of joy. It feels like spring is here. So thank you so much for sharing in the chat. I'm seeing some of your responses. A really good matcha latte, your dogs. Love all of those. Thank you so much. So we are going to kick things off. Just a little bit of housekeeping. You should see closed captions are enabled if you'd like to go ahead and offer the live transcript option. You should see in your Zoom tools to show captions. We are also, just so you know, recording this session for those that could not be here live with us. We'll be recording the formal presentation part of this. There will be an opportunity, it's optional for some engagement at the tail end of our time together. And we are scheduled until 1 o'clock today. We started at Berkeley time, so a little bit of an intro to how timekeeping works on our campus. Some of you might already be alumni of other programs at UC Berkeley. I'm seeing some familiar names in the attendee list. So in which case you would already know class starts 10 minutes after the advertised time. So that's how we ended up starting today too. We know lots of you are coming from work or other commitments. So thank you so much for taking some time to be with us this afternoon. But here's a little peek at our agenda today. We'd like to do a small warm up, offer an overview of our services here in the RISE office. Most importantly, provide some time to answer questions on your mind. And then, like I shared earlier, we'll have an opportunity to engage in an activity. It could be on your own or in community with some other attendees. And then we'll come back together and talk about next steps. So please feel free. I'm loving all the introductions to continue to introduce yourself in the chat. It looks like we've got a lot of different programs represented today. So without further ado, I would love to have our team who's present here today introduce themselves. I'll kick us off. My name is Caitlin Green. I use she, her pronouns. I'm director in the RISE office. And if you'll be joining us here at Berkeley Public Health in the fall, we might interact one-on-one in an appointment that could be for career counseling, practicum advising, pre-health advising, or at one of our many events, which you'll hear more about today. I also want to acknowledge our colleague Liam Chavez, who isn't here with us today, but supports both our team and the social impact team, which you'll hear a little bit about, and our full team of what we call summer practicum field consultants. So for those in a 2-year or concurrent degree MPH program, this is an additional set of folks who are support for your required MPH practicum. But without further ado, I'm going to pass the mic over to my colleague Candace to continue us along.
Hi, everyone. So good to be meeting you. My name is Candace Morris. She, her pronouns. I'm the assistant director within our RISE office. And if you're on campus in the fall, we'll be able to connect in many of the same ways that Caitlin had mentioned through one-on-one career counseling appointments, different workshops and events that happen. And I'm also this practicum field consultant for our HSB students. So I'll be working directly one-on-one with many of you who are in this room right now. So with that, I'll pass it along to Sarah.
Hi, everyone. My name is Sarah Ayazi. My pronouns are she, her, and I'm a practicum field consultant for our infectious disease and vaccinology students and our EpiBio students in the 2-year MPH program, as well as serving as a career counselor for all of our graduate students. Some of the ways that students can interact with me is through one-on-one career counseling and practicum advising, as well as events that we facilitate. It's again lovely to meet you all, and I look forward to getting to know you all more today.
And hi, everyone. My name's Megan Oliveira. I use she, her pronouns, and I work as Rise's manager of community partnerships. And there are a number of ways too that we'd be connected and engaged when you come to Berkeley. Some of those being, as my colleagues mentioned, through various Rise events like today, but more specifically, perhaps employer info sessions, which is some of the work that I contribute to at the office. You also might connect with me more indirectly through our many student resources. So whether you are using our online job board called Flex or using some of our resources on our Rise student resource site, you might see my face pop up in a few of those places as well, supporting different resources that you have access to at your time at Berkeley Public Health. And with that, I think we'll head on through our presentation today. I just wanted to get started with a brief warm-up activity. We wanted to get to know a little bit more about who's in the room with us today. And I know lots of folks already shared in the chat, but it's always really fun to see it pop up here. So if you're not used to using Slido, you have the option to scan the QR code, or you can go to slido.com and enter that 1833567 number and then input what concentration or program you might be considering. Got some, oh, I'm curious what the other category is that we might have missed. HPM, HSB, EpiBio. Amazing. EHS representing. Beautiful. So appreciate you all engaging with this. Oh, lots of HSB. Yeah, that's Candace, I see you celebrating. Very cool. Oh, and DRPH, welcome. Maybe we'll just allow one more moment here. Very cool. We got 16 responses. Really appreciate everyone's engagement. Sounds like we have lots of HSVers here, but welcome everyone. We're really just grateful to be in community with you all today. Moving on, we also wanted to provide an opportunity for self-reflection. I wanted to say kudos to all of you for making it here today on top of a probably very busy week and life in general. But wanted to, spend some time thinking about different things you might be excited for if you were to come to Berkeley Public Health, areas that you might be interested in developing or really thinking about how and why in all of this as well. So there are a number of ways our office can support you on your journey here at Berkeley Public Health and beyond. So these are just some of the things that our office would be able to support you with, and you likely have goals around as well. Those being practicing public health, navigating your career path, working with communities, and developing your leadership skills or style. And we recognize these kind of buckets overlap in a lot of different ways as well. But just to get us the juices flowing, we had one question. Which areas are you most excited about? And then again, you'll just, if you logged out of the Slido, you'll scan that QR code again, or you can visit the slido.com and input the number. There we go. Very cool. Navigating your career path. Looks like we have 9 votes in, and so far that's winning. I do believe you can select from multiple options. So it's always just interesting to see. Very cool. Also welcome any comments in the chat of maybe why or really where that excitement is coming from. Very cool. Okay. So I'm seeing navigating my career path coming to the top, but like we shared earlier, all of these things really overlap very deeply. And I know we'll talk more about that as well. Oh, perfect. And then one last question. We just love to be data informed, so this is really helpful information for our office. Which areas would you like to further develop and how? So are there any specific ways that you're interested in developing those skills or needs you might have that our office could support you with? And just in general, if there's anything that you're planning on doing in your own work or communities and relationships you've already developed. Internship placements. Well, you're at the right spot. Great comment. Rise is absolutely the one-stop shop for all things practicum related, which we'll get more into what that means later. Just a few more moments here. Absolutely, working directly with communities. Learning possible career paths, practicing public health and working with communities. But I really loved the comment of internship placement because I feel like that how can fall, as mentioned before, into a lot of these different buckets. Networking as an introvert, I love that one. Just thinking of, what your strengths are and how we might be able to support you in your strengths in terms of networking in that specific comment. Research experience and connections. Wondering if they provide internship opportunities and career services, of course. All of the above. I love how diverse public health careers paths can be. Absolutely. And that's one thing our office loves to talk about is just the diversity within public health and how you can meet your work interests, but also be able to be a part of the public health community at the same time. So understand the career landscape. Love that. Okay, well, maybe we'll, in the interest of time, get moving. Appreciate everyone's engagement on that, but I'm going to go ahead and kick it off to Candace.
Thanks, Megan. Yeah, thank you all for participating in some of those kind of warm-up questions. But now we're going to dive a little into a little bit about our office. And so what is super meaningful to us that we always want to ensure that we're sharing with each and every one of you really begins with our mission of our office. And our mission is elevating public health professionals to lead from where they are and affect positive change in communities locally and globally. You'll hear a lot of this from us, especially that lead from where you are. We are big proponents of you do not have to have a certain position or have a certain title and in order to actually be an amazing leader and affect a really positive change either in your community in which you live or broader. And so with that, on our next slide, as we think about some of these components that you are all really interested in, whether it's, being community engaged or, working on your career path or thinking about, your future, this all intersects with really three of our largest kind of components. The applied practice experience, which you may think of as an internship in our office and actually through a lot of different public health programs. You'll hear it be termed as a practicum for more of our MPH students. Also through leadership development. So through this applied practice experience and many of the different opportunities that you'll have throughout your time here at Berkeley Public Health, you will have the opportunity to hone in on some of these leadership skills of developing and practicing and implementing and really harnessing who you want to be, not only as a public health professional, but as a leader currently and in the future, and how you might create this narrative for yourself. And then all of that is really supported by our career services team, our central team, who you're getting to meet today, but also our field consultants. And all of that is really in partnership, in collaboration with so many areas on campus, including faculty, other staff members, other offices throughout UC Berkeley and through the larger UC system and beyond. We really harness that community engagement piece. Megan does an amazing job with this, of connecting with our community partners and thinking broadly about how we can identify opportunities where you get to practice your public health skills, but also encouraging and supporting you through that process of making those connections as well, either through those one-on-one appointments or various other opportunities, which we're going to dive into now. So on the next slide, you'll get a little taste of what we do offer. As you had heard Sarah and Caitlin and myself share, we all provide individualized career counseling for all graduate students and our DRPH students, including alumni. So as an alum of the BPH family, you do have the opportunity to utilize us for life. So whether it's 3 months after graduation or 6 years after graduation, we want you to come back and utilize us whenever you need. We also provide that individualized support as you're navigating your practicum experience. So we know that all of you have your own individualized goals. We recognize that the practicum search is a process. And even as you are in your practicum, we want to be there to support you. So we do offer kind of that summer check-in and making sure that things are going steady. And then we also have a wonderful online resource site where it's pretty much your one-stop shop for all of our RISE resources. This will be accessible to you through your berkeley.edu account once you're actually enrolled in the program. But we have everything from recorded videos of our workshops and events that we had to step-by-step instructions on how to create a resume or your LinkedIn. So there's a number of different resources that you have 24/7 access to in real time whenever you need it. And then just some additional resources that we have. We have our online job board, which we cleverly called Flex, so PHLEX. And this is where you can find practicum opportunities, GSR opportunities, part-time, and even full-time. And you'll be provided access to this in the summer. We'll also, on Flex is where you can make those one-on-one appointments and you can see additional opportunities and events that are coming up. We also do host a number of different workshops, employer info sessions. For example, we are right now planning for one with CDPH, and so we have a couple others going on. And we really like to bring everyone together for some of these really awesome workshops and events that we have. And then again, like I had mentioned a little earlier, partnership with Campus Resources. So one of our greatest partnerships is with Berkeley Career Engagement. So that's UC Berkeley's main career center, where they also provide additional resources and tools such as Handshake, which is UC Berkeley's campus-wide job board. So I know that some of you are asking or talking a little bit about internships and practicums. And so we wanted to throw a little data at you. As Megan had mentioned, we are data informed. And so we thought you might like to know a little bit of data. And so as we look at the summer of 2024, so last summer we had 124 students who had participated in the practicum, which, to just give you a scope, is around 400 hours. So that's typically 10 weeks at 40 hours per week. But just to give you a little insight into what did their practicum look like. So here we're just sharing a little bit about the setting, whether it was hybrid or in person, and then the sector. So you can see that 31% of the students engaged in their practicum within a university setting, 25% at healthcare, and so on. So we like to share these data points with you so that you have an idea moving forward into your own practicum, what that might look like for you. And I think with that, I'm going to go ahead and pass it along to Caitlin.
Thanks, Candace. So we also understand a lot of you are considering what kinds of career paths might be available to me post graduation from this program that you've been admitted to, or you may have already committed to, or you're deciding. So we certainly want to be a resource for you both right now and into the future, while you're enrolled and beyond, even as Candace mentioned earlier. This is a little bit of a high level overview, and so we absolutely invite you to share if you have follow-up questions. We also work with specific programs to provide data for those graduates specifically to be a little bit more honed in on the exact kinds of career paths that their graduates might pursue. But all to say, I'm sharing here specifically for master's graduates because we know our doctoral grads, and I know there's a DRPHer in the room, so welcome, sometimes have slightly different trends in their post-grad destinations. But among our master's graduates, the large majority pursue employment post-graduation, 3/4. This is in our latest cohort that we've got our data for. We also have a contingent of graduates who pursue fellowships. Those are typically short-term opportunities, usually 2 years or less. Some of them are as short as 6 months or 1 year, a whole range of durations. And these are often hosted by government public health agencies, or in some cases, healthcare systems, such as healthcare administration fellowships, as a combination of employment, paid employment, but also an educational and leadership development component. So we do see some of our master's graduates pursue those paths, and those have very early applications. So we want to help to support with those. And then lastly, a percentage of students continue on into another educational program. Most often that tends to be medical school or a doctoral degree. But please know that our office supports all of these destinations, whether it is being a sounding board for decision making, helping to support application review, all the way through interviewing, reviewing offers, and so forth. And so we will also, I'm seeing some great questions coming in, and we'll be sure to address those in the Q&A too. So please continue sharing. I'll do just a little bit more data sharing first. And so on the next slide, just among those who were employed, so if we zoom in a bit, not surprisingly, you all were already speaking to this. We are in a very diverse field. Public health is across all sectors, and our graduates certainly reflect that. We see students really kind of split all across these primary sectors of academia, the private sector. That could be a digital health organization, it could be biotech, nonprofits, government at all levels, local, state, federal, international, although we're mostly represented among local and state, particularly here in California, not surprisingly. Healthcare organizations, so this includes, managed care organizations like Kaiser, as well as smaller systems or clinics. And then even a small percentage of our graduates, just 3% this last cohort, in other settings, primarily in entrepreneurship or self-employment type roles. So if we continue on from there, of course, the sample job titles for these graduates are so varied as well. This is just a brief snapshot of some of the titles that students from our programs have taken on post-graduation. And we, again, can always offer, and we work with programs to provide this data specifically for their concentration or degree level. But just to give you a sense. And then if we move on, also just a kind of a visual smattering of the range of organizations that students have gone on to work in. And we look forward to adding more logos here every year. And I'm sure someday soon for you as well when you are graduating. And lastly, want to speak to that leadership development pillar that Candace introduced earlier. Our office is also home to offerings that include leadership events and trainings. Just like all of our offerings, these are interactive and really applied in nature. So, especially around leadership, we like to ask that question kind of connected to our mission you heard earlier around what does it mean to lead positive change in the world. We also offer resources as well in this area that are more 24/7. And just a small nod to one of the programs that it's a smaller program. Some of you may have heard of it if you learned about this through the admissions process. It's called the Blue Shield of California Fellowship. So our office also provides program management for that fellowship. And we work in very close partnership with our colleagues on what is called the Social Impact Team. They are also hosting a virtual session this week, so we encourage you to check them out if you're interested in learning more. But this is a new team really designed to build out this incredible ecosystem of social impact, working really to bring together communities inside and outside of the university to drive this positive change. And so they have some really innovative programs that students can participate in, especially to sort of test out even some ideas you might have for how you would like to make change in a community that you might be a part of. So stay tuned also for updates from the social impact team, and know that we work in coordination on many shared events and offerings. And at this point, we want to make sure to take some time to answer your questions. We're here to help you feel more informed in making a decision to pursue a degree here at Berkeley Public Health, or setting yourself up for success when you're here. I know there was already one question in the chat that I'm happy to answer, actually a couple that have come in. Please do feel free to direct message me if preferred. You can also add those questions in right now as I answer the first couple. So I'm happy to jump in, but again, please feel free. Also, if you prefer to ask your question verbally, you're welcome to raise your hand and we'll see that indicator show up. And you could unmute if you prefer to ask it live. So one question was around how to connect with graduate student positions. So these are things like TA positions, sometimes otherwise known as graduate student instructor or GSI, or graduate student researcher, also known as GSR roles. And these are wonderful opportunities to be employed part-time while you're enrolled in a program here at Berkeley Public Health. We also know that they can have some challenges. And so one of those in particular is as a new student, sometimes connecting with these opportunities can be difficult if they prefer or require that you've previously taken a certain course. We find it's less common for students to take on TA or GSI roles in their first semester, but particularly once here at Berkeley Public Health, those opportunities tend to get posted the semester in advance. So believe it or not, those are being recruited already for the fall among current students primarily. However, the spring of 2026 would be recruited in fall of 2025. And there are also sometimes additional academic support employment roles like readers and even sometimes TA positions that do get posted in the fall. So those are opportunities you would be learning about through updates to the student listserv and on our job board, where we invite faculty and staff within the school, within the university even, to post those opportunities, because our public health students are TAing and GSIing across campus, actually, because our degrees are so interdisciplinary. We've seen public health grad students in lots of different departments, whether it's biology, ethnic studies, you name it. So know that those are opportunities, and GSR positions as well will be shared and promoted in very similar ways. We are also always happy within our team. As you heard, you can schedule one-on-one appointments to support you in preparing applications for those kinds of opportunities. If you want to have your resume at the ready to send in the moment you hear about a new TA or a GSR opportunity. So please keep that in mind as well. Let us know if there were other questions on that topic. And we also got a question in the chat. What's the estimate in months for a grad student to get employed after graduation? That's a really good question. And I would say it's hard to estimate, but certainly we find for those who've been really actively engaged, and so we would define an active job search as, daily, if not weekly, applying to a good number of positions that meet your kind of targets, your goals, and interests. Typically, that would be in the 3 to 6 month time range. So we often encourage students who are looking to plug into a new opportunity post-graduation to start their job search in advance of graduating. Or in some cases, there are students for a number of reasons who decide to delay starting their job search until closer to graduation or even following graduation. There may be opportunities to continue on in perhaps a role that they've had while in their program. We've seen opportunities for students to develop roles as a result of their practicum or residency. So a whole range of situations, of course. And it does depend on the sector. We probably not surprising for you, do find that the time to hire in most government public health agencies does take longer, for instance, than compared to some of those private sector opportunities. So really depends on you and your goals, how much time you can make and are able to commit to a job search, the kinds of opportunities you're pursuing. But we're here for you, whether it's the fall before your graduation, the spring of your graduation, or whatever term you might be graduating in, because students are on different timelines. And of course, after graduation, we work a lot with students in those months immediately following graduation. Happy to answer any other questions that might be coming up for folks at this time before we transition to a little bit of an activity. Any other questions that you were really hoping to get answered at today's session? If you think of anything else, you are more than welcome to send me a message, put it in the chat. We can always come back around again before we wrap up today to answer any last questions. You'll also see our email address at the end as well, and we invite you to keep in touch with us there with any questions that would be helpful to get answered in the nearer term as you're navigating your next steps. We also hope we'll get to see you in person, of course. And so you might even be able to ask us some questions in person. Next week, we'll be at the resource fair along with a number of other sessions throughout the day next week. Oh, there is one last question I'll answer at this point that thank you for sharing. So asking about international opportunities for those applied practice experiences. So practicum for our MPH students, for instance. And I'm gonna actually pass this one over. I'm gonna invite my colleague Candace to chime in on this one because she leads our subgroup actually that supports around global health opportunities. So the answer is yes, there are opportunities to go abroad or even domestically be in support of global health work. But Candace, anything you'd like to briefly add on that front?
Yeah, absolutely. This is a great question and one that we absolutely want to support on. There is a smaller group of staff that work really diligently on trying to ensure that you feel absolutely prepared for a experience abroad. And so we do a lot of like workshops preparing you and leading you up to things that you should be thinking about, in addition to engaging in conversations and helping you try to network with different faculty that might be doing research globally. That's where we actually tend to see the majority of our students pursuing those global public health practicums or projects, is really connecting with those faculty. And so I would say, if that's something that you absolutely are interested in and want to pursue, when you start up in the fall, would encourage you to connect right away so that we can get you started on some of those conversations and networking. That's going to be a big thing. But yeah, we have had a lot of students go a variety of different places, and it's just wonderful to hear about the experiences that they've had.
Thanks so much, Candace. And as she said, absolutely, connect early and often with us, especially if you're interested in global opportunities. I'll just answer two minor questions before I pass it over to my colleague, Sarah, to lead us in our next activity. So one question, just briefly, is what kinds of pharma or for-profit positions graduates have matriculated into? Really good question. This itself is a diverse sector. We have a range of students, for instance, who are employed. The biggest subgroup within the private sector are within consulting firms. Even consulting firms are themselves quite diverse. There are some that might be more boutique health-focused consulting firms, other ones that are larger, like Deloitte, for example, that does recruit at Berkeley Public Health as well, and is an example of something that has a much, much wider scope within which they do have a health practice as well. Additional for-profit roles or pharma roles can be more on the technical side. So for graduates from some of those programs where they're wanting to work as things like data analyst or even around clinical research, we have a number of students, particularly here in the Bay Area, because that's a very strong presence. And then actually at those same kinds of organizations, some students who've been more on the policy side of things, for example, who are wanting to work in those settings. So quite diverse. We're happy to talk more with you as well. And then just one more brief note as well, because we facilitate access to Flex and also to Handshake, you'll get that through the center, the Career Center called Berkeley Career Engagement we mentioned in the summer. That's the best time to really be on the lookout. Typically that's happening by the end of June. And so that's actually the best time to be on the lookout for some of those opportunities like reader positions or TA positions that could be open to incoming students. So do keep an eye out on those. In addition to, you're welcome to, of course, be connecting directly with your program managers or faculty in those areas to get questions answered related to what kinds of opportunities might be available for you coming into the program for those types of roles. Without further ado, now I'm going to pass it over to Sarah. Thanks, Sarah.
So thank you, Caitlin. Excuse me. So earlier in the session, you engaged in some self-reflection, and now we would love for you all to have an opportunity to connect with one another. We recognize that each of you may be at different stages in your decision-making process. Some of you might still be deciding which program to choose or whether to pursue a public health degree. So to support you, we'll be breaking you into small groups to help each other through this decision-making journey. So on the next slide, there are several prompts, and feel free to respond to one or to all of them. And they are, how does pursuing a public health degree or attending Berkeley Public Health align with your goals and values? What information would help you make an informed decision about your educational path? And what's one actionable step you can take to move forward in your decision-making process? We are going to begin creating breakout rooms for small group discussions. If you prefer to work on this activity on your own, that is absolutely okay. You could simply ignore the breakout room invitation and remain in the main Zoom room. And for those who'll be going into the breakout rooms, we'll be sharing these prompts in the chat, and we'll also be broadcasting them, since you might not be able to see the slide once you're in your rooms. And you have about 5 minutes for this activity.
I've been staring at the edge of the water long as I can remember, never really knowing why. I wish I could be the perfect daughter, but I come back to the water no matter how hard I try. Every turn I take, every trail I track, every path I make, every road leads back to the place I know, where I cannot go, where I long to be. See the line where the sky meets the sea, it calls me, and no one knows how far it goes. If the wind in my sail on the sea stays behind me, one day I'll know. If I go, there's just no telling how far I'll go. I know everybody on this island seems so happy on this island. Everything is by design. I know everybody on this island has a role on this island, so maybe I can roll with mine. I can lead with pride, I can make us strong. I'll be satisfied if I play along, but the voice inside sings a different song. What is wrong with me? See the light as it shines on the sea, it's blinding, but no one knows how deep it goes. And it seems like it's calling out to me, so come find me and let me know what's beyond that line. Will I cross that line? The line where the sky hits the sea, it calls me, and no one knows how far it goes. If the wind in my sail on the sea stays behind me, one day I'll know how far I'll go.
We were good, we were gold, kind of dream that can't be sold. We were right till we weren't, built a home and watched it burn. I didn't wanna leave you, I didn't wanna lie. Started to cry, but then remembered I can buy myself flowers, write my name in the sand, talk to myself for hours, say things you don't understand. I can take myself dancing, and I can hold my own head. Yeah, I can love me better than you can. Can love me better, I can love me better, baby. Can love me better, I can love me better. Paint my nails cherry red, match the roses that you laid. No remorse, no regret, I forgive every word you say. Ooh, I didn't wanna leave, baby, I didn't wanna fight. Started to cry, but then remembered I can buy myself flowers, write my name in the sand, talk to myself for hours, yeah, say things you don't understand. I can take myself dancing, yeah, I can hold my own head, yeah, I can love me better than you can. Can love me better, I can love me better, baby. Can love me better, I can love me better, baby. Can love me better, I can love me better, baby. Can love me better, I didn't wanna leave you, I didn't wanna fight. Started to cry, but then remembered I can buy myself flowers, write my name in the sand, talk to myself for hours, yeah, say things you don't understand. I can take myself dancing, yeah, I can hold my own hand, yeah, I can love me better than, yeah, I can love me
Okay.
How have things been? Well, love, now that you mention it. My folks still talk, but they speak in these two-word sentences. I'm saying too much, but you know how it gets out here. No winter coat could keep out all the cold of your atmosphere. We once sang retrograde, we'd shake the frame of your car. Now I know your name, but not who you are. It's all okay, there ain't a drop of bad blood. It's all my love, you got all my love. I'm still out here with the pills and the dogs. If you need me, dear, I'm the same as I was. It's all okay, there ain't a drop of bad blood. It's all my love, you got all my love. You got all my love. Write me a list of how it is, of how it was, of how it has to be. You burrowed in under my skin, what I'd give to have you out from me. But I still recall how the leather in your car feels. And at the end of it all, I just hope that your scars heal. We once sang retrograde, we'd shake the frame of your car. Now I know your name, but not who you are. It's all okay.
Right, it looks like a lot of folks are back or almost back. I'm curious to hear what this experience working on this activity was like for you all. Would anyone be open to describing this experience either in the chat or raising your hand? Love to hear about it. It looks like everyone is back now, and yeah, just wanted to check in to see what this experience was like for y'all. Would anyone be comfortable sharing something that came up during this session or one word to describe what this was like for y'all?
I can speak a little bit about what we talked about, which is I think pursuing more education is a really significant commitment of time and for some students funding. So I think the information about the career options, which I think you guys have been very upfront and helpful with so far, is something that's definitely informing our decision. And then in terms of actionable steps, for me, I can speak for what I'm curious about, and I'm looking to speak to people who've graduated from my program to hear about their perspectives and thoughts a few years out.
I love that. I love that. It's such a big decision to move into a public health degree and getting as much information as possible, whether talking to graduate students, whether coming to sessions like today to learn a little bit more. So I just want to really appreciate the intentionality and the thoughtfulness that you and others are making during this process. I see we just have a couple more minutes left, and so I'd love to just talk about next steps, which are on the next slide. So a couple of next steps could be to connect with RISE resources. You could visit our website. Also, new students have access to Flex and Handshake starting this summer. We would also encourage new students to attend our programs. As you heard from Candace and Caitlin, and as well as Megan, there are a number of programs that we offer during the course of the academic year, and we'll be sharing some of those during new student orientation. Also, if you have any questions after today, feel free to contact us at rise.bph@berkeley.edu. And I see a question about when new student orientation is. I don't have the exact date, but I know it's the last week of August. I think it's if I'm not mistaken, it's the Monday before fall instruction begins, which is on a Wednesday. So, but as we wrap up today's event, we encourage you all to take a next step in your journey and just identify one concrete action you could take to get a little bit closer to your goals. It could be talking to a faculty member, talking to alums or other graduate students, attending more Spring Visit Day sessions this week. If you feel comfortable, we would love for you to share in the chat box what's maybe one thing that you plan to do after today to get a little closer to your goals. That's great. Jeffrey wrote connecting with alumni of the program. That's such a great way to get more information, applying to more grants and scholarships. Absolutely. Yeah, those are really great concrete next steps. I realize we are at time, but it was so lovely to meet with you all today. And thank you so much for being here and being in community with all of us. We hope to see you in person next Monday during Spring Visit Day. But in the meantime, please feel free to reach out to us if there's any way we could support. Our email address is rise.bph@berkeley.edu.